What is a coronavirus?
Coronaviruses (CoV) are a large family of viruses that cause illness ranging from the common cold to more severe diseases such as Middle East Respiratory Syndrome (MERS-CoV) and severe acute respiratory syndrome (SARS-CoV). A novel coronavirus, nCoV, is a new strain that has not been previously identified in humans.
How dangerous is COVID-19?
Although for most people COVID-19 causes only mild illness, it can make some people very ill. More rarely, the disease can be fatal. Older people, and those with pre-existing medical conditions such as high blood pressure, heart problems or diabetes, appear to be more vulnerable.
What is the recovery time for the coronavirus disease?
Using available preliminary data, the median time from onset to clinical recovery for mild cases is approximately 2 weeks on is 3 to 6 weeks for patients with severe or critical disease.
Which are the first symptoms of the coronavirus disease?
The virus can cause a range of symptoms, ranging from mild illness to pneumonia. Symptoms of the disease are fever, cough, sore throat and headaches. In severe cases, difficulty in breathing and deaths can occur.
Who is at risk for coronavirus?
The virus that causes COVID-19 infects people of all ages. However, evidence to date suggests that two groups of people are at a higher risk of getting severe COVID-19 disease. These are older people, that is, people over 60 years old, and those with underlying medical conditions such as cardiovascular disease, diabetes, chronic respiratory disease, and cancer. The risk of severe disease gradually increases with age, starting from around 40 years. It's important that adults in this age range protect themselves and in turn protect others that may be more vulnerable. WHO has issued advice for these two groups and for community support to ensure that they are protected from COVID-19 without being isolated, stigmatized, left in a position of increased vulnerability or unable to access basic provisions and social care.
Does consuming alcohol kill COVID-19?
Consuming alcohol will not destroy the virus, and its consumption is likely to increase the health risks if a person becomes infected with the virus. Alcohol, at a concentration of at least 60% by volume, works as a disinfectant in your skin, but it has no such effect within your system when ingested.
Does drinking lots of water help flush out COVID-19?
There is no evidence that drinking lots of water flushes out the new coronavirus or the stomach acid kills the virus. However, for good health in general, it is recommended that people should have adequate water every day for good health and to prevent dehydration.
Is smoking a risk factor for COVID-19?
Smoking is already known to be a risk factor for many other respiratory infections, including colds, influenza, pneumonia and tuberculosis. The effects of smoking on the respiratory system makes it more likely that smokers contract these diseases, which could be more severe. Smoking is also associated with increased development of acute respiratory distress syndrome, a key complication for severe cases of COVID-19, among people with severe respiratory infections.
Should coronavirus disease patients be isolated in hospitals?
WHO advises that all confirmed cases, even mild cases, should be isolated in health facilities to prevent transmission and provide adequate care. But we recognize that many countries have already exceeded their capacity to care for mild cases in dedicated health facilities. In that situation, countries should prioritize older patients and those with underlying conditions.
How long do COVID-19 patients need to be isolated for?
It is important to note that the clinical criteria require that patients' symptoms have been resolved for at least 3 days before release from isolation, with a minimum time in isolation of 13 days since symptom onset.